Hi, DeWeet. I am going to talk to you today about this article, a systematic review of psychometric instruments used to measure stroke, family, and caregiver health. Stroke family caregivers. This is by Cleopatra Cum and her group, including Tammy Bacchus. I think we've talked a little bit about some of this work before. Current psychometric tools, they're helpful, but they often don't look at all of the multidimensional healthcare needs of stroke caregivers in particular, because they have significant overlooked healthcare needs like physical, emotional, and psychological. Most of the tools that we use to measure caregiver health are generic. Like SF-36 is pretty common and it's really popular, but popular doesn't mean best. So it's easy, it's available, but is it caregiver specific? Will it capture all the information about caregiver health, and in particular, caregiver stroke health? Other things like the HRQOL, the Health-Related Quality of Life Score, that's helpful, but it doesn't capture all the dimensions that we're interested in. What are the health-promoting behaviors for these patients? I also want to point out that there are psychometrics that exist for a lot of them, for a lot of tools, but they're not validated, particularly in stroke caregivers. And that's what Cleopatra is looking at, stroke caregivers. So the instrument of choice, what you use to measure the thing you're measuring, affects your interpretation. Should we be measuring stroke caregivers using a stroke caregiver tool? And that's what this paper asks. We have to individualize our assessment so we can individualize our interventions. This is in the Journal of Neuroscience Nursing, and I hope you all check this out.